My name's Tim Boland. I'm a general surgeon here in Frankfort, Kentucky. I went to college at the University of Kentucky and then followed up at medical school at the University of Kentucky. I did 4 years of medical school there and then went to the University of Louisville for my surgery residency. Well, when I was a young kid, I felt like I probably wanted to do general practitioner stuff. But when I got to medical school and started actually going through the different kinds of rotations that you see in medical school, delivering babies, pediatric services, surgical services, I just fell in love with surgery the minute I walked into the operating room. I think I was captivated by surgery because I could tell that you could immediately fix a problem with an operation. Patients have chronic illnesses like diabetes, high blood pressure, high cholesterol. You have to take a pill for that for the rest of their life. But with surgery, I can cure that problem immediately. We can have you in the operating room, fix the problem, and you're better 30 minutes later. That's what drew me to surgery. My care philosophy is to treat the patient, take care of the patient, listen to the patient, talk with them about their needs, their concerns, and come up with a treatment plan that we can go forward with together. Sometimes surgery is not the best option for a patient, and you got to be willing and able to understand when that is the fact and discuss that with the patient. It might not always make the patient happy, but you want to do what's right for the patient. So we do lots of different types of procedures as general surgeons. In a given day, I may do 8 or 9 operations, and every single operation would be a different operation. I could start the day out by taking out a breast cancer, doing a lumpectomy procedure on a patient with breast cancer, for instance. Follow that with placing a dialysis catheter for a patient that needs to start dialysis. Then fix a hernia after that, take out a gallbladder after that. So the days definitely don't get boring, and that's one of the things that I like most about surgery. I can go through a whole day and not do the same procedure twice. But I really do like to do laparoscopic surgery. Laparoscopic surgery is what we call minimally invasive surgery. It's surgery through small incisions. And so, used to, if we were going to take out a gallbladder, for instance, we had to make a 12-inch incision, and the patient had to be in the hospital for 2 or 3 days. Now we can take out that gallbladder through 3 or 4 small incisions about the size of pencil erasers, and it's a 30-minute stay in the hospital. It's very rewarding for me to be able to take a patient to the operating room, do a massive operation through very small incisions, and have that patient get back up on their feet within a day or two. The first time I remember actually scrubbing into an operation was as a fresh intern, my first year of residency at the University of Louisville. A guy had gotten shot in the abdomen, and he had multiple internal abdominal injuries. That operation took 5 hours, but we were able to put everything back together again, and that one will stick with me for the rest of my life. So as a general surgeon, we don't have a lot of spare time, but when we do get it, we take advantage of it. I've got a wonderful wife and 2 kids, and I spend a lot of time with my family. We like to watch movies. My kids love to fish, so we'll fish a lot. My kids like to go play golf. Those are some of the kinds of things we do when I'm not here at the hospital.